You Ethicuties and the 40% of you who have still not subscribed to the Ethicsverse, welcome to the coolest place to be. Every random Tuesday at noon Eastern, if you think fixing healthcare and fixing our workplace is going to change our world, we got a real treat for you today. It is called Keep It Simple, Stupid. No, it's not. I'm just kidding. It's called Keep It Streamlined and Strategic. So we got a couple of great guests for you. We're going to dive right in. We're going to start off, though, with a new segment on the show. And this is called the fake news. So we're going to start with the FCPB deep freeze. The Consumer Financial Protection Bureau's new director, Russell Vaught, announced that he's shutting down all agency operations, including their website, which displayed a 404 error over the weekend. Because apparently the best way to protect consumers is the same way that I fix my laptop, turning it off and hoping it comes back on right away. Russell Vaught coincidentally shares the same name as the villainous corporation in my favorite show, The Boys. So in reality, this is less of a job appointment and more of a crossover episode. Elon Musk and his team are also given access to the organization's IT system. So stick around for the next week where we'll be rebranding CFPB to Y. New Attorney General Pam Bondi's Day One memo she hit the ground running with 14 new policy memos on her first day, tackling everything from foreign corruption to environmental justice to death penalty cases to workplace policies. So this marks the most aggressive Day One agenda since my New Year's resolutions, which are definitely still happening. So don't worry about it. I'm still on track here. Just like everyone's first day at the job, she spent most of it writing down big plans that will definitely happen right after she figures out how to work the coffee machine. Because any inefficiency expert will tell you the best way to accomplish major institutional change is to try changing absolutely everything at once. You got to rip off the Band-Aid sometimes. And finally, FCPA enforcement shutdown you may have heard about last week. The Trump administration announced this week that they're pausing enforcement of the FCPA the Foreign Corrupt Practices Act, which bans American companies from bribing foreign officials. So this is part of Trump's new foreign policy strategy called Make America Bribe Again. Just kidding. All right, we're going to dive right in here to the Ethicsverse. As always, you know, we love talking about all the great thought leadership going out there. There's some great podcasts going. Check out the Ethics Experts. This is the fastest growing ethics and compliance podcast in the world. Top 2%. Imagine top 2% global podcast. So people like business ethics. So we're ripping out a ton of great episodes. Vera Sharapova just dropped, and we're 3 episodes away from the real special bicentennial, our 200th episode. If you are not with Ethico for your disclosures or for your sanction screening or for your case management or for your investigations, what the heck's wrong with you? So we are the only company that is really dedicated to healthcare out there. About 80% of our clients are healthcare companies, so we are purpose-built for this industry. And if you're an Ethicsverse subscriber, I should say, you have the Promised Land promotion. So if you're sick of your current provider or you just want to see what else is out there or you want to really level up your program for this new chapter that we're stepping into where we're going to drive more engagement, more efficiency, and more effectiveness in our programs, then we got a nice little promotion for you. 15% discount to what you're paying right now on an apples-to-apples basis. Of course, some restrictions apply, but up to 1 year free. And this really helps with a lot of the change management that goes on in making a change to top grade your program, I will say. World famous Ethico book giveaway is in full effect. So we've effectively almost doubled our book giveaway rate with these Tuesday sessions. We're giving away Business Psychology and Compliance. This is a really phenomenal book. And of course, we are giving away 5 of those. So as we get started here, like we say every single week, now twice a week, your network is your net worth. So drop your LinkedIn URL in the chat and expand that. And, there's so much opportunity in healthcare where there's this massive regulatory overhang, this massive regulatory load. And there's a lot of opportunity for us to really attach to that purpose of providing better care for patients across, our systems. So we're going to dive in today. Let me introduce our guests. Our guests are Krista Muzak. How's it going, Krista?
Good. I look like 7 of 9 in your AI.
And Angela. How's it going, Angela?
Great. I look like I did in high school, so thank you.
You're back. You're back, buddy. All right, so we're going to dive into program effectiveness. Program effectiveness is this amorphous thing, this thing that you never really know if we're there yet. And we're going to dive in today on how to keep it streamlined and strategic. So I'm going to pass it over to you guys and we can kind of do a little intro and just dive right into the slide deck. As always, we want this to be very organic. So keep those questions coming in the chat. Keep your tips coming in the chat. I'm sure a lot of the things that we're talking about today are probably some things that you've thought of. Maybe they're things that you've employed. And so share those tactics. Our greatest asset is each other. It's this industry that we're a part of. And the more we can share with each other, the more that we can sharpen each other and be there for each other, the more impact we can have in our organization. So with that, let's dive right into keeping it streamlined and strategic. Stupid. Just kidding.
Yeah, we'll leave that part out.
Yes.
Thank you so much. And thank you, everybody. What a great way to spend your Tuesday afternoon. Thanks for spending it with Angela and I. So we do have a deck, but we're also totally willing to go off script, answer questions, have our dialogue with Nick and team. So my name's Krista Muzak. I work for Pfizer. I'm in Tampa, Florida. And last year for the HCCA, I presented on the concept of project management and process improvement. I currently do process improvement here at Pfizer, and it's really an exciting spot to be. And especially in terms of my entire compliance background, there was always this there's the dotting of the I's and crossing of the T's, but then there's also sometimes you're just kind of like, oh my gosh, I have so much work to do. And I don't know, what's the best way to prioritize it and get it done, and stakeholder engagement. And I sit here and, I have flies in the ointment, and there's got to be a faster way to do these things. So I've been leaning into project management and process improvement, and really noticing a true improvement in terms of being able to get what I need to get done, better my ability to engage with stakeholders, meeting deadlines, and also producing or delivering a quality product. And then I'll turn it over to Angela to give a little background on herself.
Great. Thanks, Krista. I'm Angela Smart. I am with Intermountain Health here in the western side of the states. So Krista's down in the sunshine. We're in the snow here in Salt Lake City. Right now, I'm a senior compliance partner. I support different risk types in different areas within the department, including behavioral health and emergency and trauma, which includes EMTALA, involuntary commitment, and a number of other things. And as Krista mentioned, last year at HCCA, my presentation really focused on root cause analysis with two of my colleagues here from Intermountain Health. And as I was listening to Krista's presentation last year, our presentation kind of took you up to the point of how do you decide what to do, or which root cause analyses should you do. And it didn't go farther. And her presentation really was sort of the meat and potatoes of how you do those. And so we connected and felt like this was a good melding of the two to kind of bring them together to strengthen a compliance program. In my past life, I did process improvement much more in the behavioral health space than I'm doing right now, but that's kind of where some of my roots are, is in process improvement. And so it felt like a good connection and a good way to sort of move that root cause analysis and compliance program effectiveness forward. So that's where we are coming from.
Yeah, and we're going to be talking today about the skills that you need in this next chapter of the ethics and compliance game. Obviously, you still need to know all the regulations. You need to know the words on the page, the black and white, the lines in the sand. But as we become more impactful in the organization, what that coincides with is us becoming more like business people. And what we're talking about, process improvement, this is like, as Angela said, it's the meat and potatoes of business. Being a good business person is constantly looking for ways to improve and make it easier to achieve the organization's objective. So this is a topic that I think is extremely important, particularly in healthcare, and I'm excited to dive in here. So why don't we talk about what this Streamlined, working smarter, not harder, is really all about? And of course,
Great.
Ethicsverse members get the slides. You know what I'm saying? So if you want to see these slides, you want to save them, they're coming for members. Yeah,
and let me just kind of bounce off of something you said, Nick. I think process improvement, sometimes we think of, we've got to think of something to do. We've got to find a project to improve upon. It really should be part of your business culture. And if you can work these tools into how you do business, it will save you time. It will be more efficient, but it will also, I feel, be more effective, because you really will be identifying root causes of things, hopefully taking care of them, and you're not seeing the same problems coming back and back and back. So, in terms of streamlining, what we mean by that is really working smarter, not harder, and trying to incorporate some of these skills that Krista's really good at, and we'll talk about later. For root cause analysis, my opinion, and I think you'll see this in other compliance literature, a root cause analysis is a really key part of a compliance program. It focuses on processes and not on individuals. So it's not there to lay blame. If we have something that's coming back and back and back, and it's not seeming to get solved, and it's showing up in your incident reporting, or you're getting a lot of complaints from your your partners, your clients, your customers, your healthcare providers, then this is a good opportunity to really dive into a root cause analysis, which again, we want to focus on the process and the system, not on who did the wrong thing when. There's some key differences in root cause and in just our regular investigations. And one of those, we investigate things all the time as compliance professionals. We're always getting calls. We're always having to answer questions. And from my background, I see that as sort of, we are the emergency department. We are the ED trauma of the organization in terms of fixing things, providing answers, quick fixes. But a root cause analysis is more surgical, and you're going to need a team, and it's going to have more of a structure to it. So you're going to need to make sure you have the right people, stakeholders. And sometimes when we say stakeholders, we immediately think leaders. And yes, we should probably have some leadership on there. But stakeholders are the people that own the process, that use it every day, that are the ones that are most can provide most information about why that process works or doesn't, and how they use it and what they need. So we want to make sure that we have frontline caregivers, if that is the type of system or process we're looking at, and not overload it with leadership. Although we do want leaders buy-in so that there is some weight behind it to get things done. Another potential pitfall to root cause analysis is that as compliance professionals, we're really good at issue spotting. We are really good at looking at a question and identifying, well, that's a Stark issue, that could have a privacy element, that could have this, that, and the other. On a root cause analysis, we want to be really laser focused on the problem that we're trying to solve, because we will see other things come up as we look into a root cause. So we want to make sure that we, at the end of the day, have solved the root cause process we're looking at, and not all the peripheral stuff. Although we can certainly keep track of those and manage those in a way outside of that root cause analysis. So resist the urge to solve everything, which can be a bit of a struggle for us. And then finally, go ahead, Nick.
Sorry, I was just going to interrupt, because that whack-a-mole approach really seems to be something that I think a lot of people are probably living in right now. And it's really hard to zoom out and say, okay, I know this is an immediate issue right now, but if we only put that Band-Aid on that problem, we haven't really solved the problem. So I just wanted to add that to your, sorry for interrupting. Go ahead.
I agree. No, and whack-a-mole is very apt description. And especially, I was listening as Nick was explaining all of the different regulations. We've had a lot of executive orders coming out. There's a lot being thrown at us in the healthcare industry any day, but especially in the last few weeks. So it really is important to focus on what we want to have happen and what we're working on in front of us.
I'd really like an executive order outlawing plane crashes. A lot of those going around lately. Maybe that's coming.
Maybe so.
This whack-a-mole thing, it's so hard, right? It's so hard because you roll stuff out and the engine starts to rattle and you start to get these signals, and it's like, is this actually a problem? Is this just from the change? You know what I'm saying? Like, as somebody's adopting a new process, sometimes there's just natural resistance where it might not be a broken process. And so what I have found is that, like, when you're doing something new, you need to keep the end user in mind. Think of the end user first. And when you've rolled something out and it doesn't seem to be working, or you're getting some of that resistance, I think the main place to look is not at that end user, but rather at the system itself, to your point. Because there's probably something that if we can step out of ourselves or step outside of it and sort of scientifically observe, there's probably something to improve there. And the other thing I just wanted to add, with respect to like whack-a-mole, I'm a big fan of the Pareto principle, the 80-20 rule. You can't boil the ocean. You can't do all the things. You have to take that risk-based approach and focus your efforts on the things that are actually going to move the needle. A couple little smoldering fires versus the inferno. Obviously, the inferno needs your main attention. But you see all the smoke and you think, my gosh, there's fires everywhere. It's a difficult thing to sort through. It's hard to prioritize the management of these different projects.
Yeah,
agree.
A lot of the recent Ethicsverse webinars have been related to HR, and that is the area that I'm embedded within that business. Global enabling functions. But the reason I'm pointing that out is because when we're also talking about trying to identify the root cause and then come up with the, based on the risk, is this something that we need to fix? Is if we're doing something that's human behavior driven, we can't solve for every single human, each of those humans, that
Huge
behavior of person X, Y, and Z. And it goes back to the 80-20. Like, are we going to get the biggest bang for our buck and make the largest population happy? And we have to accept the fact that there will be a couple of people, because it's human, they, would be confused or didn't understand. But the thing is we, you have to, you can spend your entire day trying to fix one problem for the masses, as opposed to saying this has got to be good enough because I've got a backlog of more information to handle.
And usually a solution, a lowest common denominator solution that appeals to everybody, probably has no teeth and no real controls anyways. So, you know what I'm saying? Like, what's the goal, Yeah.
Exactly.
And to keep that 80-20 thing going, our root cause really is solving the 80%. The 20% is those day-to-day issues that are outside of that. That's sort of the emergency work we do, right? Is everything beyond that. So, which kind of brings me to my last point here, which is root cause analyses are often resource intensive. We're including a lot more people. Some of them are going to be leadership. We want to be very mindful of everyone's time. We don't want to waste time, especially when we have caregivers involved that might be part of the process and part of the team. We want to value their opinions and perspectives, but we want to make sure that we are really focusing on the problem, again, that will affect their work and their effectiveness in healthcare. So let me move forward. One of the things we talked about last year at ACCA was compliance scope for an RCA. In your healthcare organization, you may have other groups or other departments that really are focused on patient safety events, patient harm events, clinical care, and that type of thing. So if you do have that differentiation, you want to make sure that you're not overlapping the work they're doing or taking over their scope. So compliance issues that a root cause that would be more relevant for root cause and compliance would be things like revenue cycle, coding, billing, charging, all of those fun things that are always at the top of our compliance incident list. Privacy issues, which are also usually a higher issue, physician financial relationships, cybersecurity, which Nick's done a couple of good webinars recently on AI and all of the potential benefits, but also some risks for that, as well as regulatory, which we've touched on. Right now, here in my company, we're in Utah, Idaho, Montana, Colorado, and Nevada. And most of those states, if not all of them, are right now in the middle of a state legislative session, which means that we're getting some state regulatory changes to compete with sometimes, or to add to our federal regulatory requirements. So keeping on top of those. Risk assessment, biggest bang for your buck. Again, if you have if you see things regularly in your incident reporting that are coming up, they would be something you might want to consider for a root cause if you're seeing the same problem over and over again. So paying attention to your risk assessment and to your prevalence and incidence data. This last box, in a different color, says compliance program, because we've sort of been talking about all of the sort of systems issues that we try to solve in compliance. But I think for looking at our compliance program, there's some really good material there to work with. For example, are we seeing our, we all have required education that's has to be done within our company. You have to have HIPAA, you have to have different types of education done. Are they being done? And if so, are we being alerted? Is there something there that we could dig into and see why either education isn't being completed or why it's not being reported if it's not completed? Policy management. Do we have a policy management system that makes sure that all of our policies are current and being reviewed on a cadence that we've defined? So I think there's some elements there within your compliance program that you could actually root cause and identify better ways and more efficient ways to manage that compliance program.
You know, you made the point before that root cause analysis can be very intensive, right? Very labor intensive. It requires a lot of people, especially to like adjudicate a risk, or, you know, once the root cause has been identified or whatever. But I also want to encourage everyone to just kind of try to develop root cause analysis thinking on your own. You know, many times, you know, we've talked about this a bunch, like how a good like business consultant can come in and pretty quickly on the back of a napkin come to like an 80% accurate answer for like what the course of action needs to be. Like if it's a turnaround situation or something like that. You have those skills. Like if you've been in this industry for any amount of time and you have a 4-pound nuclear reactor between your ears, you see these kinds of things. And I think it's just a habit of starting to ask like, why is this happening? And what could potentially be causing it? So just that kind of 5 whys mentality coupled with like the scientific thinking of like hypothesis forming to say like, okay, well, maybe it's this. Then you can very quickly do a little kind of mini root cause analysis to see if that actually is, you know, to see if that hypothesis is, you know, real or, you know, valid to like pursue further. So I'm just saying you can iterate through, you know, back of the envelope, back of the napkin root cause analyses before you have to form your full task force and, you know, attack this problem. You know what I mean?
Absolutely. I mean, you know, why isn't your kid getting his room clean? Start there. Start simple.
How do you know about that, by the way?
Oh, I have experience.
Gotcha. Okay.
And beyond my compliance resume.
Yeah, exactly. I don't want to steal one of Angela's slides, but just to the comment about the 5 whys. One of the things that I do with my team every once in a while, if we've got the extra time, after we've talked about, you know, we drill down with the, you know, using that methodology, and sometimes I just look at them and I'm like, okay, what haven't we considered?
Right.
Give me something crazy. It doesn't matter, but what haven't we considered? Because it's very, very easy, and it's human nature. Even with the 5 whys, it's carrying you down a particular path, and that's great. And you usually get to where you need to go. But it's like, is there something else? Is there a little tributary on that river to solution that we haven't even considered? And then you know, but then if there is something, then you have to weave it in and decide is that something we even have capacity to deal with? Is it that big of a deal? Yes, no. But it's constantly being curious to try to, but you have to be careful, right? You can't like be so curious you never get anything done either. So.
Yeah, but to your point, we have to break out of the path sometimes, because sometimes we're kind of thinking inside the box and we don't know it. You know what I'm saying? You're just kind of throwing things out there. And I think breaking out of that box is really helpful to start to consider some things that maybe weren't on the table before. Yeah, okay, go ahead. Sorry to interrupt on that. I would love to hear though about that room clean thing, if you got some experience with that, because boy, the yelling ain't working. You know what I mean?
No, it doesn't. If we have time at the end, I'll expound on my motherly.
Please do. I have. I'm ready for notes. Okay.
Yeah. Actually, it's funny. Mine just had to move out of the house. Now my house is really clean.
Oh wow. Okay. So there is some light at the end of the tunnel. Very good.
Child is the root cause to why your house isn't clean. Yeah.
Yes, exactly. I eliminated it. So, anyways, but just because we were talking about, you know, so Angela was introducing us to the root cause process, and she'll go into it a little bit further. But just in terms of the part about program effectiveness, is you do want to be asking yourself these questions. And I don't want to, you know, drain the slide or whatever, but it's really, it follows along with that PDSA. You're planning, doing, studying, and then acting. And it's always a cyclical, it's a gut check. It's a cyclical process, because again, it kind of goes back to the comment that we just had about the path. So you're following a path and you land on, okay, here's the root cause. Then you start figuring out how to solution it, but then you have to constantly like, wait a minute, is that let's study it and make sure is it still in line with our strategic plan? Is it still in line with the company that we want to be, the product that we're delivering, whether it be a good colleague experience or whether it be something, you know, a patient experience, a drug experience, that sort of thing. So it's constantly following through that periodic check of the data that you have.
Yeah, that flywheel is the thing to like get into your head. I call it the plan, do, check, act, the plan, do, study, act. It's the same thing. And it really can be plan, do, check until you figure out something that's working, and then you loop in that act. But it's helpful to your point. It's 4 steps. Plan it. What's going on? Okay, maybe if we change this policy, this is going to fix it. Okay, plan, do it. Okay, do a little test. Okay, I'm going to change this policy for an A/B test group of individuals. Okay, check. Is the behavior changing? Yes, it's changing. Okay, great. Let's act. Let's roll this out across across the whole population. So running through that cycle, it gets you into this continuous improvement mode, and it makes it a little bit easier to have this effectiveness conversation, because effectiveness to me is like health. You can always be healthier. Are you healthy? Yeah, I'm healthy, but I can be healthier. I can get stronger. I can run faster, right? Like there's always more you can do. And the fact that it's an ideal that is unattainable technically doesn't mean that like it has to be a scary thing to pursue it. You just have to get a little bit better. You just have to get into that kind of continuous improvement mode. And so I would argue that a program that is not being run or is not full of individuals who are in a continuous improvement mode can never be effective. And I'd also go to say that if somebody is asking, is my program effective? I would say, well, I'm planning, doing, checking, acting. I'm in a continuous improvement mode. It's absolutely not perfect, but look at this list of things that I've gotten done over the last year that have built more effectiveness. That's where we want to live. We want to live in that thing. It's not a binary, it's not a binary black and white 1 and 0 type of a thing, program effectiveness. It's a process. It's a journey,
Mm-hmm. Yeah, and you have to stay agile.
And I think it's not a destination, like you said, Nick. It's a process. And if we're documenting our efforts along the way, that goes a long ways for proving our program effectiveness. Even if we haven't fixed everything, it's showing and proving to our regulatory bodies or accreditation bodies, whatever, that we are actually engaged in trying to improve the compliance of our program, the compliance of our companies, and demonstrating what we know didn't work. Because sometimes that's half the battle, is finding out what wasn't the problem, because sometimes we make those assumptions.
So, I mean, again, I'm really on this like health analogy, but like if you're going to a new trainer and they're asking you, I'm not going to train somebody unless they're like serious about getting in shape and they're serious about their health. Like, show me if you're serious about, this endeavor. And one person says, well, I kind of go to the gym when I can, blah, blah, blah. I'll walk on the treadmill, I'll do this and that. That's one person. The other person says, well, here's my notebook, and I've been going to the gym for the last 6 months, and I've recorded every single workout, and I'm really trying to hit new personal records, every week. My goal is to hit a personal record every week. I'm just saying, like, for that personal trainer, how are they going to make that assessment of effectiveness? Well, they're going to look at the data that is there, and they're going to have a conversation. And based on the inputs, the data points that they're getting back from that conversation, they're going to make an assessment, and it's a subjective assessment whether or not this person is serious. And again, this is a perfect, analogy for this effectiveness thing. To Angela's point, if we're documenting things and we're authentically trying to improve, well, then we're going to have a ton of evidence to point to, and we're going to have a ton of things, a ton of anecdotes to talk about to reinforce this claim that we're making, that, we're really serious about driving effectiveness through our program.
Definitely. You can go to the next one too.
All right. So let me talk a little bit about identifying compliance issues. We talked about sort of the big buckets of topics, but I think there's some other elements to that. And I've got 4 of them identified here. The scope of a problem can often be the driver for why we would want to do a root cause analysis. If it's something enterprise-wide or if it's in multiple departments. The risk level, and we talked about this a little bit earlier as well. What is the urgency for getting something corrected? Have we had past corrective actions that have not worked? Is there some kind of loss potential, either financial or legal or reputational, if we don't get something fixed? Likelihood, what's the probability this is going to happen again? If the answer is high, then we probably should take a look at it. Even if it's not something that's a super high risk, if we are seeing something that always comes up, that's a resource drain. That's a resource drain for the people that are involved in the process, and it's a resource drain for us as compliance professionals who have to go and investigate it or look at it and see if we can try to fix it. So those are things that are often really big dissatisfiers in a company. If you can fix somebody's day-to-day problem that's happening all the time, they're going to be much more engaged with compliance and and we're doing what we are there for, to help provide service and support the organization. Regulatory scrutiny, if we've had surveys, if we've had any kind of state or federal reviewing of some of these issues, those are definitely something you'd want to consider on your list, as well as organizational priorities. Sometimes these supersede all other types of risk types. So if it's something that's important to the organization, or if there's a reputational issue at stake, or it goes against our mission, vision, values, then those are going to also take priority in terms of what we send to a root cause.
And again, think about using those words as you're interacting with the business. Those help really frame out the issue and kind of translate what you care about into a language that they understand. This is a reputational issue. This is, there's a high likelihood of occurring, right? Like, we have to convey to folks whose buy-in we need to get something done, the magnitude of the issue,
And I think it also goes to the culture of compliance in the organization. If we are taking things really seriously that people are bringing to us, which we hope we are, we ask that, please report to us any concerns you have, compliance, risk-wise, whatever. And we don't do a lot with it, or it just sits there and they continue to report it and report it and report it. That's not really a very effective way to run a compliance program. It's also not a great way to engage our workforce in compliance. If they can be a partner with us in helping to solve something, that's gonna go a long ways, and they will feel empowered to talk to us about other things. And it won't be it went to the round file of compliance and it disappeared. So we want to be responsive. In addition to the other topics and elements we just spoke of, root cause analysis, you want to make sure that there's something you can do about it. So is there something else that we can do in terms of policy and procedure clarification, or maybe there isn't even a procedure written about a certain system or process? Is there something in our compliance or operational programs that needs to be fixed? Are there controls that we could implement to eliminate a problem? Or are there other factors that are contributing to the event, which we'll talk about a little bit later? So I think there's, as you're identifying what to do and what to send a risk root cause and whatnot, again, resource intensive, but we want to make sure that we're really thoughtfully thinking through some of these different issues as we choose what to focus on.
Got a great question here from Lance, if you guys don't mind. Lance, thanks for sharing this question. So the question is, doesn't there have to be some point where it just can't be quote unquote better? To use a sports metaphor, are we ever going to see someone run a mile in 5 seconds? No, we're not. So when is the best point reached? Same for our process. How much better after, say, 100% of claims are right? So how do you know when you've reached that sort of natural limit of what a human being can, generate,
Sure.
Back to his running analogy?
I would say, and maybe Chris has got other thoughts, I would say that as an organization, we accept certain amounts of risk. Right. We can't solve for everything. And so in some cases, it would be a discussion with leaders as to what is our risk tolerance. At what point do we say we're going to have errors and that percentage is acceptable to us? Sometimes those are imposed on us, in terms of billing and coding. We have to, we may have our own organizational rules about what our risk tolerance is for those type of things. So I don't know that there's a hard and fast rule. I think it's a discussion with your compliance leadership, with your operational leadership, those who own the process, to say, at what point do we feel like we've done what we can do? Because we can't ask our caregivers for, if we're not providing them stopgap controls, like there's hard stops at every point so they can't do something wrong, then at what point do we feel comfortable? And I think that's a conversation to have with your leaders. And I know for me in my organization, we've had those conversations because there are certain things that we are just, there's time constraints, there's software constraints, there's all kinds of, there's financial constraints because we simply can't pay to fix this problem. There's a way to do it, but it's not feasible. So I think those are conversations you have with your leadership.
Yeah.
What would you say, Krista? Anything to add there?
Yeah, I totally agree. Because in addition to everything that Angela just said, there's also like something that a lot of people hear, progress over perfection. So where are those incremental gains? And then for all of the reasons Angela listed, financial or other resources, there is a point that you just like either naturally have to just say, okay, this has got to be as good as it can be. Anecdotally, I did work on a project where it was the solution was kind of like what Angela said. It had steps and controls where it was preventing people from even doing the wrong thing at all. The problem with that though is that that ended up making the process so clunky and time consuming that
right.
we had a totally different risk. We had to do a totally different root cause analysis because our solution was like way too far to one side. So we had to like roll it back and find that happy medium where the primary risks are addressed. Then we can address human behavior through policy and training, change management, that sort of thing, and then then plan, do, study, act, right? And then you figure out, okay, where is that sweet spot where we had the right amount of effort, we're getting the right gains, but we're also not making it so difficult and cumbersome that nothing ever gets done, and everyone hates it, and then they're like, I'll never do that, and then they find some, they circumvent the process you put in place. So yeah.
Yeah, and what I would say to Lance to this question is just be careful about the false positive you can get from kind of being in the comfort zone and saying, well, this is good enough. It may well be good enough, and you may be trying to squeeze blood from a stone, which can't happen. But I would look outside to see, like, what are other people doing? Like if someone, there was a long time where people were running 4-minute miles and everyone's like, this is the human limit, that's it. And then somebody broke into the 3s, and then a bunch of people were able to break into the 3s. I, by the way, have my new personal record, speaking of health, new personal record for a 5-mile run. 3 miles.
Which is?
So, yeah, 3 miles.
I don't have any emojis.
But I'm saying, what's possible?
Laugh. I can't do it.
What's possible? Like, what are other people doing? If you're getting 2 reports per 100, for example, and there are other people in your industry of a similar size that are getting 6 reports per 100, well, then there's probably some improvement to do. If you're setting a record and you're, that incremental effort diminishing returns, well, then that's a point to say probably the effort is not going to be worth the benefit. But I think it's a constant process of like assessing where we're at and picking our eyes up from our desk and seeing like what else is going on in the world. And again, testing that hypothesis. In theory, if there's 50 reports per 100, 30 reports per 100, and I'm getting 2 or 3, well, then there's order of magnitude more risk intelligence that exists in my organization. I'm going to do a plan, do, check, act, or plan, do, study, act to see if I can start to get a little bit more of that risk intelligence and see if it's actually worth the effort. Great question, Lance. Thanks a lot.
Can I just tack on one additional
of course.
thing? Because what you were just saying too is that staying cyclical and constantly reviewing anyways is a best practice. But part of the other thing is that to what you were responding to Lance about, Nick, is technology is constantly changing. People are what we know or what we think we know is changing. So for exactly that running analogy, right? So okay, we look at where we are with AI. And, we're still talking about WhatsApp and people using, the messaging system to talk about work when they shouldn't be. But it's all sorts of things. Like we're in a spot now that we never could have even anticipated a couple of years ago.
Right.
So we have to stay on our toes. We have to stay agile and just going back and checking, okay, are we currently, 2 years ago, we were at the best we could be. Are we still there, or is there an opportunity now to improve again? Okay. That's it.
Yes, phenomenal. I have so much to say. So a lot of comments here. I'll try to incorporate them in a moment.
This is all great. I was just thinking with this slide we're all looking at, maybe next time I'll change it to my child won't clean his room.
There you go.
But this is a good
You got to
example.
resonate with the audience, or at least with me.
Does. I mean, it's a real life problem. So you mentioned the 5 whys earlier, Nick, and this is an illustration of it. You get up, you go get in your car, it doesn't start. Why? Well, the battery's dead. I think a lot of times we stop there and we run to, the auto parts store, and we either get a new battery or we run to the garage and they charge it up, or you get your neighbor to give you a jump. But we don't dig down into what really was the root cause of why your car didn't start. And if you don't, then it's going to happen again and again. So this is, I think, a good example of, how you get to that why. And then looking at what was the intended process. If we had taken it in, is there a likelihood that this wouldn't have happened? I think that's a good question. And you've got to your root cause when you can ask the question, well, if we had done this, if I had taken my car in, is it likely this would have occurred, that the car would have been dead? No. Or what's the likelihood that it's going to happen again if I don't do this action? Then that kind of helps you get to your root cause. So looking at what steps did occur, what steps didn't occur, and making sure that we're really thoroughly reviewing through a process instead of jumping to the easy, quickest solution and making an assumption. This slide, I took most of this information from the Joint Commission, which has a very robust root cause analysis process. What other factors contribute to the incident? And I think this is an interesting one because often we just, like I said, make assumptions, or we have hindsight bias. And we say, well, we know why this didn't work. So going through, even if they seem irrelevant, to go through and ask, were there human issues? Was there mistakes and errors? Was it a coverage issue, burnout, whatever? Environmental issues, external things we couldn't control. Was there a power outage or weather? Looking at all these different categories, even if you don't think they matter, can sometimes highlight some really interesting data that you might not consider if you hadn't gone through it. I think that there's a great value in doing that. And sometimes you don't get to the root cause, you find contributing factors, or you find other areas for improvement that you can sort of put on your list so that you can make sure you don't forget those and you can deal with those later. But make sure you are very thorough in how you go through your root cause and asking those questions. And then finally, reviewing through and saying, where else is this happening? Could this be happening somewhere else in my organization? And then finally, and this is sort of the bigger part of it, is developing an action plan for each of your root causes, because there can be more than one, considering what actions to put in place. And Joint Commission also has a really nice list of sort of the strengths of actions. So education is generally thought of as sort of a weaker action. Now, we do it all the time, and it's not irrelevant, but a stronger action would be things like engineering controls into a system or a software change, making sure that we're simplifying a process. If it's going through too many hands, or if there's too many people involved, or there's too many steps to a process that don't need to be there. Or simply standardizing a process. Maybe there's too many ways to do something, and we want to make sure it's standardized so that we don't have aberrations and sort of workarounds. So I think those are all things to consider as you're getting to the end and developing your action plan, making sure those actions are strong enough that they will likely prevent it from happening again. Ensuring accountability, make sure there's an ownership to some of these processes and actions. And then, of course, a monitoring plan, which gets back to our cyclical, iterative and repeated cycle that Krista has talked about and we'll get more into next.
So a root cause analysis is just a business process, and it's a creative endeavor. And I think a creative endeavor without like any kind of constraints is like there's no creativity in it. Like a painter needs the constraints of the canvas in order to make that masterpiece. And so there's my point is there's a lot of freedom in adopting a process for root cause analysis. Forcing yourself, to your point, to go through those different factors, forcing yourself to ask those questions, it's going to shake loose some things that maybe if you didn't follow that process wouldn't sort of come out. And so really adopting this process and using it and sticking to the process is really going to help you fast forward to the impact and the fix that the RCA process can generate. Resist
the urge to assume. And just because you've seen it once doesn't mean this is the same. And
great point.
Staying curious. Yeah.
Yeah. And one other point is like, if you're on a journey of self-improvement, that is going to be impossible if you don't develop the skill of like self-observation. That's the ability to step outside of yourself and consider scientifically and objectively how you may have acted. And so that's important for our own personal development, but it's also really important, to your point from a couple minutes ago, it's really important to do that with our program. Many times we can't see the forest from the trees because we've been part of the program, and we know the litany of like assumptions and decisions that went into the creation of whatever is in place. If we can't step out of that and objectively reconsider it with fresh eyes, then the odds of us staying in the inertia that we might be stuck in is a lot higher.
Absolutely.
Yeah, I totally agree. And we are going to talk a little bit more about that in a sec, but in terms of the guardrails or our painter's palette, the part that I wanted to talk about is project management using lean principles. That does give us our framework. Excuse me. So for people who are, at least for people who aren't familiar with those two concepts, and or you are familiar, but I want to just kind of walk you through the direction that I'm going to take it. So project management, we have those clear accountabilities. We know, who's doing what and what are they not doing, but you want to get the right people in the room. And what's the objective? And I want to talk about how we've zeroed in on the root cause, but now we have to say, like, what is the objective? We know, like, how do we solve this? Because there's a whole myriad ways that you can solve a particular problem, but we have to have one objective, and that's the objective we're going to stick with the right people in the room. And then planning, and we've mentioned having controls in place, and then just making sure that everything's well defined. And then in terms of lean principles, the thing that I like most, and I'm not going to boil the slide, and I want to be respectful of everyone's time. The part that I like the most about lean principles is that it's people focused. So it's that last, the second to the last bullet down at the bottom. Lean is people focused, adding value through the development of people. Because the other thing is you're getting, that, what's that saying? People adopt what they help create. So if through project management, you have the right people in the room with a clear goal and objective, then you make it about improving that person too. So now they can be champions of your solution, champions of your program. So that's highlighting, and then I'll share some keys pieces of it. Angela, I know you started talking about making assumptions. Do you want to talk about some of the other parts in this slide here?
We've kind of covered them all. The only ones I would add is making sure that we are listening and open, and that means to all the people in the room, not just leaders. Making sure that it's a safe space. Try to do our best to diminish defensiveness and take the focus off of an individual's failure. Making sure that we've mapped out the process and done some front loading to really plan and get all of our information available to the group that's looking at it, and then documenting what we're finding, documenting what we're not finding. And I'll let you go on from there so that we don't miss your slides, because you've got some good stuff.
Sure. Okay, thanks. The one thing I want to say about the documenting it is I think that's one of the key pieces. So in addition to what you were saying earlier, when we were talking about just staying ahead of technology and making sure that we're constantly in a cyclical process, here's an example of your battery example. So the only type of car battery that I'm familiar with is the kind that just dies. So there we go. However, I have a brother that also lives here in Florida. He's lived here about 30 years. One of his cars was ruined during the hurricane, and he wanted to buy a new car. So he called my brother-in-law, who's up in northern New York at the Canadian border, and said, I want to get an electric vehicle. And my brother-in-law said, okay, here's some examples of, this is my feedback. But the one thing is that electric batteries lose their power faster in colder weather. And my brother from Florida spends about 5 months up in northern New York. So there's a new technology that changes what you think you know. And if you're trying to do a root cause analysis and why did my battery die, the reason my battery would die is because I didn't take it in to get serviced. But my brother-in-law has this new technology in an electric battery, and without the documentation and understanding what he's working with, he would have had a totally different root cause for his battery dying. So it's just an anecdotal to illustrate the type of thing, like, why you don't make assumptions, because it's not always going to be exactly the same thing.
Yeah, I mean, by its nature, you don't know what's in a blind spot,
Right. Yeah, exactly. Yeah. So so I'm going to just go through a couple of slides about the framework, the guidelines. So when you have your group together, we're going to start doing your solutioning for the root cause problem. And then what I would recommend, if it is a big enough problem that needs to be solved, I recommend doing a formalized project charter. This is the first entry into it. And really what it is it clearly defines, and I apologize if it's really small, it's like -2 font. So sorry, people. But it clearly defines who's involved, what is expected of each of the people, how long the project is going to last, start and stop, and then what is the goal and the objective. So it's truly a charter. So everybody sits there and they all agree,
cool,
this is what we're going to do. No extraneous, no last minute, no, hey, did you think about, nope, you had your chance. It's now what's in the charter is what we're going to do. And it's really, really important. And I was on a project about 1.5 years ago, and it's massive, but we agreed to only do this one sliver, and it's been going for about 12 months. Just the sliver of the whole thing. And anytime when we were working on it, anytime someone would say, what about XYZ? We'd say, that's not part of what we agreed to work on right now. Please put it in the parking lot. That parking lot's massive. It's like, 73 stories high. But just to start with the whole, to finally, because the root cause analysis is so important, but now what do you do with that information? We have to solve it. So starting with the charter, if it warrants it. If it doesn't warrant, if it's not that big of a deal to warrant a full-on charter, that's fine too. But it's always good to at least make sure everyone's on the same page as to what you're doing and what you're planning on doing.
And can I pause real quick on this? There's so many skills that we need to be really effective in our role, particularly in highly regulated, businesses, right? And I think it's easy to get overwhelmed because there's all these experts out there. So it might take 10,000 hours to become 100% on something, to become an expert. But I think it takes like 10 hours to become like 50% smart on something. So you know what I'm saying? Like the graph goes like this, and then it takes, those 10,000 hours. And so if you can embrace that, then you can get pretty smart on project management without, going to college for project management. You can get pretty smart. 50% smart is pretty smart. Like 50% smart on behavioral science, right? Just by reading a couple of books. I'm not saying you're going to have a PhD after that, but you don't need a PhD to just get going and start incorporating some of these principles. And so this industry, this job is so interesting because you need a cornucopia of skills to be really impactful. Of course, you need to have that sort of legal mind and understand the business, but you also have to understand human nature, and you have to understand process improvement, and you have to understand how to manage projects if we're going to create, make the vision that we have for the future a reality today, So I love this. I love how tactical this is. And I just want to see one more emoji explosion for these guys. This is a phenomenal episode. Thank you so much.
I wish I had emojis to explode. I can just see everybody's. Yeah. I can just do this.
Yes, that works. That counts. I got a tally of those. There.
All right. But just to keep on exactly what you're saying. So that project charter is just the one that I used. And it's, if anybody has similar ones, you can probably share it in the chat or share it when we're connecting, networking offline. It's just the one that we use that just keeps everybody focused. As we're drilling down through the project management and lean principles, the next one that you would want to do, or recommended, is this SIPOC. So SIPOC stands for suppliers, inputs, process, outputs, and customers. And even though everything goes this way on the piece of paper, you don't do it in that order. What you first want to do is you want to start out with your process. So say, for example, your process is investigations. We've talked about that a little bit already today. So if your process is investigations, the next thing you want are those. So you start with that middle yellow box, and then it's the boxes down at the bottom. You want to have a start and a stop. So when you think about the process of an investigation, where does it start and where is it stopping? And then you have, okay, so intake form or a report comes in, that's where it's starting. And then you have, and it could be anywhere between like 4 or 7 boxes along the bottom. I just have 5. And then, so you have the whole process of you're taking in, you're intaking, you're interviewing, you're documenting, you're creating your report. And then where is your personal or your company's stopping point? Is it when you report to the board, or is it when at time of closure? And then within the rest of these other categories, it's just thinking about it's really to take a look at who is impacted, which would be the outputs and the customers, and who is your who's putting in who's your supplier would be. The supplier could be like the people who are making the report. It could be your hotline, that sort of thing. And then the inputs are just the information that you're receiving. And the SIPOC is really the diagram. It's to identify those higher level, like what are you looking at? And it also is kind of pretty good gut check too, to make sure that from your root cause analysis, are you looking at your problem the same way? Do you need to wiggle it a little bit? Are you totally off? Did you take this totally the wrong direction, and no matter what you do in this project, you're not going to solve the problem that was identified in the root cause analysis. So it's a nice like intermediary second step to just make sure that you're looking at it the right way. And it also helps, it's a process that's done within the project team, so everybody is understanding the whole process and and really the suppliers and what go into your project, and then what are you creating, what's your output, who are the customers. So one of the other examples could be you're creating some drug, so what's going in, you need water and heat and chemicals and stuff, and who's supplying those, who are your suppliers. And then the outputs would be, there's residual things, there's the actual vaccine or drug or whatever you're making, and then who are the customers. So it's just a nice visual way. I'm just gonna.
It drives clarity. Krista, if you don't mind speaking up just a little bit, because there's such great content here. But to your point, it's all about driving clarity forward, so that there's not all these inferences and there's not all these miscommunications, which seem to be inevitable when there's a group of people working on something together.
Right. And which leads us to the next part. So for clarities, we have the fishbone model and then the different types of waste. So there's the waste would be, overproduction, waiting time, that sort of thing. And then the fishbone model helps you when you're looking at your problem, what needs to be these 5 S's plus safety. What needs, so in the battery example, right? Do we have, do we just have a bunch of batteries laying around? No. So that would be one way to look at the problem. Is there a standard process for handling? Can you standardize how batteries are dealt with? Yes, that's your user manual. It's in your glove box. So it helps you break down what needs to be sorted, straightened, shined up. So, and the meanings of those are, so I just touched on standardized. The solutions need to be sustainable. It can't be just a one-off, or you're going to end up having additional problems. The safety is an extra one, just in case what your problem that you're working on does require, either some sort of safety equipment or some sort of safety protocol. And then the other pieces of it is just making sure that everything in its place, everything has a place, and everything in that place. Is probably the best way to describe how you use the fishbone model. This one, I just want to show this so this is the final drill down. So we started project charter, SIPOC, the lean principles, the 5 S's. And then this is a true example. This is that project I was talking about where we only just did one tiny bit of it. You can see there's 11 different swim lanes. So in this one piece of it, there's 11 different groups of people that participate in this problem. And then all of the little ziggy zaggies in blue are opportunities for improvement. So, the one thing at the very top of see all the green boxes at the very top, that's all of our suppliers and inputs there's 13 or 14 of them. We stipulated at the beginning of this project, we can't even look at that. It's too much. We already know that it's a problem. We'll solve those problems when we get to it. But we knew that everybody they're all funneled into this one process. And so this process flow diagram maps out what's happening and identifies areas for improvement.
So what sliver are you working on? Is it one of those swim lanes? Or this is the sliver?
It was the whole thing. I'm not in the sliver. I'm in the project trying to fix I'm on the blue squiggly things.
Gotcha.
It's been a lot.
But I mean, how helpful is this, right? You break it down to the component actions, and you can see it all on one page, and you can start to really diagnose where those pinch points are and where those constraints in the process are,
Right. Yeah, no, exactly. And then part of the other thing is just looking at it visually and saying, holy smokes, do we really need 11 different groups of people? Like, look at just having that many people, cooks in the kitchen, what can go wrong, right? So trying to solve, I mean, there's our straightened and our sorted right there. We're looking right at it and we're like, oh boy, this needs work.
And it just gives you a new picture of the problem to look at. You have a new vantage point to consider it. And sometimes process gets so embedded. And to your point, 50 people are freaking touching it, and there's all this variability around it. It's hard to really diagnose until you can, sometimes it's hard to like organize the garage until you take all the crap out of it. You know what I mean?
That's exactly it. Yep. And then, and when you do take all the crap out of your garage, you do have to have, there are some additional limitations, right? So part of the thing is your time and your resources. So in terms of effort and impact, those, the higher impact, low effort, higher impact, the lower right quadrant, those are quick wins, right? You don't need to do a lot to be able for it to be nice and flashy. The ones in the top corner are the ones that are probably going to have that program charter, and you probably need to get, executive sponsorship, probably a lot of money, that kind of thing. But this provides you just a quick idea of like, okay, where does my root cause analysis fall in? And who do I need to engage? What kind of money? Angela had mentioned funding and just the resource of a human being trying to solve these. So I think it's really important it's helpful, another diagram really to take a look at it, to view your approach.
I mean, our entire job is making bets with our focus and our efforts, in a framework like this helps us really kind of categorize those bets,
Yeah, I agree. Actually, it's funny that you mentioned it like a bet. It's true. We're hedging our bets there. And this is our final slide, and I appreciate for everybody that stayed on an extra few minutes. So the DMAIC process, very similar to the Plan, Do, Check, Act. So you're just, you're looking at it, you've defined it, you've measured it, you're analyzing, improving, constant improvement, and then you put your controls in there to make sure that's, an additional check to make sure that things are running as smoothly as you had planned.
Wow. Round of applause. One more round of applause for these guys. This was really, really phenomenal.
Angela, and you, Nick. Thank you.
We've started to get this reputation on the Ethicsverse of putting out, content every single week that's not these fireside chats that are kind of low effort. I mean, there was a lot that went into this presentation. There's a lot of phenomenal information here that we can start implementing right away. It's not tough to do a fishbone analysis. It's not tough to start trying to step into this type of Plan, Do, Check, Act or this continuous improvement model. So appreciate you guys being so generous and being so transparent with your tactics and your strategies. Follow, there should be some icons on the console. Follow Krista and follow Angela on LinkedIn, connect with them. And we will see you next Thursday. We have a great session on Thursday. We're going to be talking about the beautiful marriage, the beautiful partnership that can come from HR and compliance working together instead of having that tape in the middle of the room like the twins who can't stand each other. So we are going to be talking about that, some great tactics there. Thank you all for coming. Hope you found value. Please give us feedback on what we can do to add more value. We're right at this inflection point, man. These next couple of years are going to be real exciting. If we can start doing some new things, start incorporating some new strategies like this into how we go to market, so to speak, and how we make our impact in the organization. So thank you all for staying. Love you all. See you Thursday.